5 years ago, Megan Phipps had abdominal pain so severe she struggled to make her own lunch.
It was that sort of sharp, localised, but then it became this persistent dull ache that was just present at all times.
Her GP tested for appendicitis. The results were clear.
He said, take a deep breath, you're a young woman, I think you should do some stress management techniques, try yoga, try journaling.
Megan left the appointment in shock.
It was really jarring to have my experience so easily dismissed.
A new doctor, 2 gynecologists, and 9 months later, Megan was diagnosed with endometriosis. Laparoscopic surgery changed her life.
I woke up and for the first time in, 9-10 months by that stage, I wasn't in pain.
Megan's experience is not unique. A survey of women in Canberra found overall low levels of satisfaction with endometriosis healthcare. It also found perimenopause and menopause care hugely lacking. A quarter of women reported getting little or none of what they needed when seeking support, information or treatment. Felicity Brazel knows the feeling all too well. It was 2020 when she found herself suffering through hot flushes, brain fog and anxiety.
I'd be at work and I would just be in tears and I'd be going, this isn't me.
The wait for an appointment with her usual GP was longer than Felicity was willing to wait, so she saw a different doctor at the same practice.
It was someone who was a younger woman, hadn't gone through it and was really having to go and didn't know much about it and having to look up on the website.
Felicity walked away with a prescription for antidepressants and the realisation that seeing a doctor who specialised in women's health was vital.
You can't talk about menopause in a 15-minute chat.
The survey also found 45% of women felt doctors were taking them only somewhat seriously or not at all seriously. It's a statistic that's hard for Dr. Laura Chapman to hear, but not to understand.
So often women will come to see us here saying that they have felt dismissed or not taken seriously.
And the most commonly mismanaged conditions, endometriosis and menopause. A big part of the problem, according to Dr. Chapman, is the prevalence of 10-minute medicine.
There is only a certain amount of time that you can give to that woman if you're booking appointments every 10 minutes.
For Lauren Anthus, the head of the think tank behind the survey, the findings offer a powerful tool to advocate for change.
So whether that's about affordability or whether that's in fact ensuring that people are taken seriously when they present with certain issues, but it also gives us the ability, hopefully, to work with the community, so to work with them around where to go for their help.
What's now clear is there's plenty of room for improvement. Rosie King, ABC News, Canberra.